Steve Forster. The purpose of my presentation is to inform you about Medicare, its different parts and purposes. We've all heard Grandma and Grandpa talk about it, heard it on the news, and we've definitely seen all the commercials this time of year, every year. But what do we really know about Medicare? As with anything where the government's involved, it can be very confusing, but it's imperative that we have at least a basic understanding of Medicare, how it works, and what it does, because at some point, whether for our loved ones or for ourselves, we're all going to have to deal with Medicare sometime in our life. So what is it? Well, at its core, Medicare is health insurance obtained from the United States government, effectively making the U.S. government the largest insurance provider on the planet, serving nearly 50 million Americans. I spent 3 years studying the parts and workings of Medicare. As a health insurance agent, I felt I was obligated to understand it and in turn explain it to my clients so that they had an understanding and they got the coverages that best fit their needs. First, I'd like to talk about the intended purpose of Medicare, what it is, who it's for. Then we'll discuss the different parts, what they're meant to pay for, and finally, tell you a little bit about Medicare supplements, what their purpose is, what they pay for, and what they'll cost you. So as I said, Medicare is a government-backed health insurance system. And while it was battled for all the way back to Theodore Roosevelt, ultimately it was finally signed into law in 1965 by President Lyndon B. Johnson. So what is Medicare? The big question. Medicare is defined as health insurance for people 65 and older, people under 65 with certain disabilities, and people of any age with end-stage renal disease. Medicare is not full coverage. It was never intended to be full coverage. It was, quote, to help contain medical costs as we age. So, as you can see there, different things that it pays for and doesn't pay for. The system we refer to as Medicare consists of several different parts. So let's break those down. Part A, health insurance or hospital insurance. So this, if you're admitted to a hospital, this is what pays those costs, along with other very specific costs like hospice, home health, very specific things that Part A pays for. Most people don't pay a premium for Part A as long as you have worked for at least 10 years, held a job, paid taxes for 10 years. That premium is covered. Additionally, most people are automatically enrolled when they turn 65 as long as they've filed for Social Security benefits. Next, Part B, which is your medical insurance, medical coverage. This is what pays for your doctor's visits, any kind of outpatient care, very limited prescription drug coverage under Part B. Cancer drugs, mostly things like that. Most people do pay a premium on Part B. It usually comes directly from your Social Security benefits. It's automatically deducted straight out of that check. Just like with Part A, a lot of people are automatically enrolled. Some people have to take action and enroll themselves. It's important to note that Part A and Part B both pay benefits on an 80-20 basis. The Medicare pays 80% of the cost, leaving the other 20% to the insured, who is ultimately responsible for the other 20%. As of 1997, there are two different ways to get your Part A and Part B benefits. The first being from the government, known as Original Medicare. This is the Part A and Part B that we've been talking about. The second is from a private insurance company who's contracted with Medicare. These are called Part C, more commonly referred to as a Medicare Advantage plan. So, and then the last part to discuss is Part D, which is your prescription drug coverage. Since Part A and Part B don't offer any coverage for prescriptions or medications, Part D is a plan that's obtained from a private insurer. Most people will have to enroll themselves in a prescription drug plan. There is a monthly premium along with various co-pays depending on what medication and what plan you have. So as you probably noticed, none of these parts pay 100% of medical costs. So what do we do with the cost that Medicare doesn't pay? Enter the Med Sup. So what is a Medicare supplement? Medicare supplements are insurance plans offered by private insurers. While they're purchased from a private insurance company, they are heavily regulated by the federal government, standardized by letter, you can see. So what that means is any company that you purchase the plan from, they're required to pay benefits on a basis set forth by the federal government. Medicare supplements are something that you would enroll yourself in with the help of an expert. You will have a monthly premium, and it's important to note that a lot of these plans, the premium will increase as the age of the insured goes up. And please keep in mind, this has been a 30,000-foot overview of Medicare. There's many factors involved in the process for which you should get expert advice. So tonight we've talked about the purpose of Medicare, the different parts, as well as the supplements that can be added. Simply put, Medicare is health insurance purchased from the largest insurer in the world, namely the U.S. government. And as I said earlier, it can be very confusing, but I hope that I've shed at least a little bit of light on the subject for you. Thank you.